So the common assessment methods for these various domains, when it comes to knowledge, we've got a lot of technologies, a lot of tasks that we are very familiar with for assessing knowledge. The multiple choice, essay, tests, short answer, lots of different formats that are basically asking a question, getting an answer. When we come to higher level cognitive skills, we have other technologies like problem sets in engineering and math, projects, creative writing, critical analysis of a philosophical argument, oral presentations. Again, things that are primarily based on cognitive knowledge and problem-solving skills, but expressed in different ways, different tasks. For attitudes and values, we have done a lot with questionnaires and surveys, so we ask them, priorities and values will contrast two priorities. Which one do you lean towards? What's your preference? How do you answer these questions? And in performance and skills, we have various kinds of demonstrations in various real world or controlled environments, more or less authentic. So you can diagnose and troubleshoot a faulty piece of equipment, do a performance in the humanities, other domains as well. So these kinds of tasks get linked to different kinds of outcomes. Excuse me. And the key is to recognize that depending on what kind of outcome you're interested in, you may have different technologies available to you. But the key is to be creative. Excuse me, don't feel tied to these technologies for doing your assessments. All right, so the big challenge, and this is where we'll probably spend the most of our time, is defining the task. Because this is where, as I mentioned, you can be innovative and creative. This is where a lot of the real work in doing a good assessment comes, is figuring out what the student needs to do to show you they've achieved this outcome. First thing I would suggest is when you look at your outcome, think about how this would be demonstrated in the real world. So if your student had this value, had achieved this, had actually internalized this value that you were emphasizing, how would you see that? How would you know that they had it in the real world? What would you look for? Because most of what we're doing, we want to have some real world impact, I hope, because otherwise it becomes a very academic exercise. So if it's going to make an impact in their lives after they leave school, how would you know? And so doing exactly that, thinking about, okay, this isn't going to show up until they're actually in a classroom. Okay, so if it has to be a classroom setting, can you replicate that in class, in a controlled environment that we have here? I know what it would look like in the real world. I know how difficult it would be to replicate that in the classroom. If it's really important, it may be worthwhile doing that. So if so, then start doing the creative work of thinking of how can I simulate in my constrained environment the kinds of context or situation or problem that would elicit this behavior. And so I would guess you're thinking about, you could think about a simulated classroom with simulated students. We're getting very expensive, but this is the kind of a task that would have a good prospect of eliciting the behavior you are looking for. So that's the logic here, of trying to figure out what kind of task can we come up with to elicit this behavior. So what we're talking about often in framing a task is to go from something that's very authentic, that would happen in the real world, to something that's much less authentic, but cheaper, that we can actually do. So in this case, you can actually observe a student do this sophisticated history and physical task, something we really try to do or teach in medical school, actually do it with a real patient. That would be highly authentic. That would be kind of the ultimate. So if they can do it in real life, okay, we've got good evidence. But in reality, that's hard to observe. It's chaotic. There are lots of other factors going around. We can't schedule it. so we try to find more controlled tasks. So we might bring it to do a simulated patient. So like your simulated classroom. That would be more manageable in some ways, less realistic. We might actually do the role play. Have practice taking a history, doing a physical exam on your colleagues, on your classmates. Or you might go very low authenticity and give them a paper patient, ask them, what questions would you ask in this context? So it becomes less realistic but more manageable. So it's usually this trade-off between realism, authenticity, and expense. And somewhere you'll find a balance where you can do something that is relatively authentic at a price that you can afford in terms of resources. So we just talked about this trade-off. So that almost every assessment we do is a simplification. And it's necessary, but to be cognizant of what you're giving up when you simplify. So when you simplify, you throw something out as being irrelevant. Be careful that those irrelevant things really are irrelevant. So another aspect of this is whether the task is planned or natural. So when it's planned, it's controlled. And that may be great for convenience, for making it logical, but a lot of what we might be interested in producing is a learner who can adapt to the complexities and the uncertainties of reality. And if that is a key part of your outcome, you may need to keep that in mind in developing your assessment tasks.